Welcome back, and this is Mission Ghana on News 360. Some aged persons at Apantaga Atsiboga in the Bongo district of the Upper East region are unable to access health care under the National Health Insurance Scheme.
They are too frail to move to the nearest CHPS Compound, which is about 1 hour 30 minutes by foot and 45 minutes by motorbike.
They told TV3's Wendy, Laryea the only solution to their problem is to construct CHPS compounds closer to them.
These two old men are both old and frail. One cannot stand or walk and could only drag his buttocks across the floor to move. 80-year-old Naya Adongo is assisted to even lie down. He has been sick for 3 years.
He's seriously sick with stomach pains. And then in the evening he feels cold.
He's too weak to reach the nearest CHPS compound.
He has got the health insurance card and the free health care too. It has reached them, but the worst is that because he cannot walk and there's no means to send him to the health center. That is why he's lying down. And more to the point, the fatness of the health center.
With no one to help him, he will still be home. Aborigo Adongo, also 80 years, said he cannot walk to the hospital.
Anytime he wants to get up, it's like muscle pull. He will be experiencing some muscle pulls. So he cannot walk unless he sits about 30 to 45 minutes before he can be able to get up.
For 4 months, he has battled a sore on his heel with no success.
The health center is far from here.
We found Agila Akaribo under a tree. He complained of stomach and chest pains. He has never been to the hospital because he cannot trek to the nearest CHPS compound, although he knows of the free healthcare policy for the aged.
He has heard of the free healthcare, but once it's far, he cannot reach there. That is why he said, okay, let me just relax myself here. When death comes to meet me, then I'll go away.
He believes a health center in the community is the only way out. The assemblyman for the area said the situation is frustrating.
One time they called me to come and pick somebody to hospital. When I got there, the person is finished. I just died. Here I'm standing now. This is the place we have agreed with the community members and then the landowners to build the CHPS compounds. The DC assures us that if funds comes, he will give us the CHPS compounds.
TV3 earlier aired a story on inadequate CHPS compound in some parts of the Bongo district. A second visit to Amanga was to make a follow-up on any improvement in access to healthcare.
There has not been any change since TV3 came.
The district chief executive of Bongo, Alexis Ayamdo, confirmed Apantaga Atsiboga is one of the earmarked areas for a CHPS compound this year, but the construction of the facility is dependent on the release of a district assembly common fund. He also entreated residents of Amanga to keep accessing healthcare at the nearest CHPS compound.